I'm a respiratory therapist.
I am a respiratory therapist.
I'm a respiratory therapist, and I save lives.
A respiratory therapist is a professional who has been trained to work with patients who are affected with chronic lung disease across the spectrum.
So anything that affects your breathing, a respiratory therapist is likely going to be involved in the care of that patient.
A respiratory therapist is not only a therapist, but a practitioner. We help patients in so many different capacities, not only with breathing, but with education, with lifestyle. So we have many different roles throughout healthcare. It can involve working in a hospital such as the ICU, a neonatal ICU. We can work in the emergency department. We can work in diagnostics and therapeutics. We do outpatient education. We do smoking cessation, asthma education. We work in pediatrics. So, a respiratory therapist, we hold so many different roles that really help the community in so many different ways.
I'm a respiratory therapist.
I'm a respiratory therapist, and I care for my patients breath by breath.
The thing I like most about it is the variety of the day and the variety of the career. In the hospital I'm at, we have neonates all the way up to adults. We have a burn ICU, trauma ICU, so we can be anywhere at any time of the day.
There is always a patient that needs something unique. Sometimes there are physicians that have different needs that we have to take care of.
Obviously, it starts off finding out where I'm at, where I'm assigned to, getting a report from the night shift, seeing what the plan is for the patients, and then going to see every patient, doing rounds.
I work in pediatrics, so I may get 5 patients, may get 6 patients, but they're patients that need help with breathing. And my job is to provide them with their treatments. A typical day would be going from giving a treatment to maybe a 5 or 6-year-old that's slightly sick, then going into an intensive care unit, somebody that's much more ill, and every decision that I make on how to set that life support machine could affect their outcome.
We have so many different pieces of equipment, and they all do so many different things, from a wide variety of life support equipment to sustaining equipment to equipment that just will deliver oxygen.
So a typical day is checking equipment, getting with our people. We also will go in-house and check on the therapists in-house and see if they need anything. But primarily we're waiting for calls, and they come. We usually do 2 to 4 transports a night, and they can be anywhere from 2 or 3 hours long to 6 hours long, or sometimes even beyond the shift.
We see each patient anywhere from 1 time a day to 6 times a day, depending on the type of patient.
Day will typically end right about 5, 6 o'clock in the evening, so about 12-hour days. I'm a respiratory therapist.
I'm a respiratory therapist, and I love taking care of people.
I worked in a teaching hospital, so it was routine that we always had students, following us. Precepting students was one of our responsibilities. So that's how I got into education. I became a clinical instructor. That also opened another door for me when a program director position became available.
Empowering the patient to manage their chronic lung disease so that they understand that they can live a good life. It's about quality of life, so I feel that if I can help teach them on how to handle their chronic lung disease, it's about having the confidence that they're going to be okay.
The education and dealing with the patients, it's very satisfying to me. You go in a room with someone you haven't seen in a while, but they look at you, the